Hi to Nursing 531 class. Dr. Hastings here. Hope everybody had a good first week of the semester and is having a good Labor Day weekend as I record this. So, we move on now to curricular foundations. And looking at this is more of the substance of what this course as a foundation course is. We're talking about curriculum. We're talking about, in this case, this week, the reasons that we think about designing curriculum and creating programs and then creating, of course, the courses and the assignments that go along with those. So, as we move forward, we know the basics relative to curriculum have to do with some type of learning experience that is programmed, a course of study, something that's planned in effect then too, and just in general, an interaction. Okay, a scenario in which teaching and learning takes place, in which teachers and learners discuss and interact themes that are important relative to their discipline or their focus for taking a course. So most of the courses take on meaning according to educators and their own individual stylistic approach to those things, and then their values and beliefs. For sure, it's a product when a course is implemented and when it's integrated into a curriculum. But within all this, what's really important that we think about goals first. Remember I said last week, even think broadly. So philosophical statements and goals are really critical at the foundation level. And that then we think about some level of organization or sequencing. So certainly for a curriculum associated with a nursing education program in academia, this is particularly true. And then in institutional healthcare settings, it's certainly true relative to the mission for which a education department is articulated and let's say acclimated with, whether that is some kind of nurse or medical residency type of program or whether it's a staff development type of approach where annuals and annual research and then trainings that are specific to the culture of treatment units or new initiatives in the system, all those things will beget a certain degree of attention to organization. And then, hopefully, we do integrate evaluation. It's on a continuum. We'll be getting into evaluation later in the semester, but just the idea that we need to be looking at how well a curriculum, how well a course will adapt to the curriculum and the goals associated with it and provide good outcomes. So we're always thinking evaluation. All right, so the purpose, create learning opportunities, of course. So build student or novice nurse professional knowledge and skills. And the goal, of course, in all, whether it's an academic setting or a healthcare system based setting, is to build practice competency, okay? And of course, I just say in parentheses, not just how to answer multiple choice test questions, which nursing education in the academic sense has always been tabbed for relative to the ultimate outcome with state board exams, with the NCLEX. We need to think, more broadly than that, of course, though that is critically important. We know that with having some level of program effectiveness in mind in academia, we're always thinking about NCLEX, but we do want to consider how do we make for just good clinicians. And that's true, obviously even more germane, for institutional settings, healthcare systems that are having orientations for new nurses or any kind of trainings for novice nurses or for experienced nurses who are changing units or are being exposed to new types of skill sets. So look, this is a process that is germane to education in general. It can be applied anywhere from kindergarten to higher ed, from academia to hospitals, as I stated here in the slide. So in all this, the components are critical. We start with goals, and then at the foundation having philosophical statements about those. We then consider some level of organization, and then we integrate the evaluation. So just like what was stated just a moment ago, I wanted to re-emphasize these points, so I put another slide into this. I think it's really important, despite what the overall context and the conceptualizations about curriculum might be. It's really important that we consider those elements. We also consider then curriculum development as a process, and within the context of process, looking again at building upon the curriculum and considering cooperation amongst our different specialties, amongst other disciplines possibly, and considering how change and even conflict within the context of an academic or a healthcare system-based setting for education may involve a lot of overlap, okay, and ongoing iterative type of decisions that have to be made to foster collaboration. That's certainly an important theme with interprofessional themes about education amongst healthcare disciplines. But we look at context, we look at politics, so what's going on right now? So you had a chance in week 1 to look at some of the links that I posted in that week 1 module that really does look at a range of driving forces and influences upon curricular development within the context of education, of nurses is our focus, but let's say of healthcare in general. And of course, you know, that context with the drivers, ones that were noted from last week, IOM and Benner, and of course, different political initiatives that are driving healthcare. We could say the Affordable Care Act certainly was a driving factor. We'll see what's next down the pike. Those things are important. But in all, the curriculum process, as mentioned before, for a course influenced by personal interests. You know, for me, my ground is in psych mental health nursing, so I tend to think in terms of how does the psychosocial realm fit within the curriculum, in this case now at Cedar Crest College. But also philosophy, judgments, and values. Apologies if the recording of me overlaps values there, the word. Values are important. Our attitudes, our feelings about what we're doing relative to creating teaching and learning experiences. Okay, and here's an example of depiction of process. So we look for, and we think about curriculum and curriculum design. Typically, there's a curriculum already in place, so we're always looking at the idea that there might be a need for change, and we're trying to gain support for that from the organization that we're associated with, be it academic, be it healthcare system-based. We have to have some kind of agreement on philosophy, but in all this, you know, we're trying to, in that type of collaboration, formulate goals, okay, that are associated with designing curriculum and then implementing and evaluating it. So it's a continual process. You know, we tend to think about refinement. We tend to think about that secondary to evaluation. What are the outcomes from that evaluation? So we'll talk about evaluation in a few weeks down the road. Key steps in the process. Again, let's consider incorporation of outcomes and philosophies, okay, and the associated concepts in the curriculum. So goals, always think broadly. What do we want to do? The goals should reflect broad abilities of graduates and their proficiency relative to the domains we talked about before, cognitive, psychomotor, and affective. But understand that goals are a public statement of what our graduates will be like, because for us in nursing, having a state board licensure exam that all the states and the state boards of nursing recognize, that's critical because we are vested and grounded in public understanding of what we do. Certainly it's in title with legislation, but even from the standpoint of what does proficiency in NCLEX really mean. I think if you ask the lay public, they're not going to understand that. But let's just say it's about, hey, this test helps us determine if our graduates are proficient and safe. So that's important. That's public health domain kind of stuff. All right, so in philosophy, we have to make sure that philosophy is consistent with the institution we're coming from. So think about it from the standpoint of an academic setting, certainly like Cedar Crest, or a healthcare institution's mission and philosophy and values. So all those considerations. Again, look at your slide deck that's posted beyond this recording, because my box here is taking up some of that schematic. The external forces, again, some of the links we had from week 1 that referred to looking at accreditation standards, when I had links to AACN, CCNE, and NLN, and organizations like that. Certainly the healthcare issues that we referred to, roles of nurses, especially with, again, the need for change, and well articulated, in NCSBN circles and in from Benner, radical change needing to address how nursing can really meet healthcare needs in a complex system. So all those kind of things impact. And how do we get there? The learning experiences. We're trying to keep that in mind as we try to create curriculum that will support competencies. And again, I always defer back to the KSA's, knowledge, skills, and attitudes. Okay, so we want to consider how that mission statement is consistent with what we're doing relative to curriculum development. Okay, and philosophically, there are broad philosophies that sort of underlie what we do, and Billings and Halstead referred to those. I highlighted humanism, postmodernism, and progressivism because a lot of this refers to sort of an empirical approach, so we can measure what's going on, and that we are also supporting, again, learners in the context of their professional development, in terms of their competencies, in terms of their independence and autonomy, their development relative to what they need to be like to the real world, and to, in effect, the idea about how they are at the center. Okay, just like we talk about caring for patients and patient-centered, I tend to think about learners and learning-centered experiences, which applies to you as well. So in all this, the philosophies that we tend to embrace are things like the nursing meta paradigm. So critical: health, environment, nursing, person. But remember, environment is very contextual, so I mentioned that here as per, again, those driving factors that we referred to last week and will continue to refer to. What are the things that really matter relative to supporting a philosophy of why we design and implement curricula? So in a nutshell, all right, and again referring to what was in the chapter of Billings and Halstead, think about the plan. Okay, we have goals, but then we think about planning, in this case for engagement, because we want to support learning. What we deliver to students, and then the KSAs, the competencies, the outcomes. So philosophically, we need to conceive this, not just in terms of the mechanics of our curricular design and implementation, but what is that going to look like ultimately from a philosophical foundation level. All right, we have to keep that in mind to keep us grounded. And we tend to think about that if you refer back to a nursing theory course that you would have had in the past, then too, how do those theories maybe underlie how we approach maybe from our specialty genre and where we go. So in this case, because it's general, think about a nursing department's philosophy in the academic setting. If you're in an institutional type of environment, think about this from the standpoint of the mission of the healthcare system, all right, and their philosophy. So integrate that. All right, we want to just make sure that the philosophical statement is congruent with that of the parent institution, and that it also reflects we who are the department folks, faculty or staff, our beliefs and values then too. All right, so in all that, we need to agree on the philosophy of the parent organization. That's critical relative to the notion of a critical milestone in terms of our being in agreement and to create a curriculum that's consistent with values. But then we need to think about the context and the other drivers as referred to, IOM, Benner, and then the process. And I refer to Cedar Crest College mission goals here too. That's important as we consider curriculum development revision here. All right, or the big drivers from the accreditation standpoint, again, NLN or AACN or CCNE, because we are, and right now we're ACN at Cedar Crest, but we're going to AAC and CCNE soon for accreditation standards. It's our next phase. We're accountable to those organizations, okay, to get the stamp of approval. So that's important, all right. In all this, curriculum is about determining a need for change. Creation of new curriculum begins with the acknowledgement that we need to make some change. We need to grow. We need to develop to make for the best practitioners now. All right. And some faculty may acknowledge that need for change, while others may resist. That's part of the package. We need to gain support, though. Change cannot occur without support of faculty administration, so we need to be on the same page. We need to work as a team in that respect. So, okay. So, we need to have that support. We need to collaborate, and we need to think about what will this look like in terms of the best interests of the organization as a whole as we move forward, be it academia or healthcare organization. All right, so that's my introduction for this week. I hope you enjoy the material and look forward to seeing you online as we discuss this.